The inexorable passage of time brings with it a multitude of physiological transformations within the human body. But perhaps none is as consequential to our overall vitality and longevity as the aging of the cardiovascular system. For our elder community, those who have spent decades accumulating wisdom and experience, the preservation of heart health and vascular integrity is not merely a medical concern, but the very foundation of an independent and thriving existence. As we age, our arteries undergo a silent, progressive structural alteration known as arterial stiffness, a condition characterized by the gradual loss of elasticity in the vascular walls. This stiffening is primarily driven by the degradation of a highly flexible protein called elastin, coupled with the simultaneous accumulation and cross-linking of collagen, a much more rigid structural protein. Over decades, cellular stress, oxidative damage, and the formation of advanced glycation end products conspire to transform the once supple arterial tree into a network of increasingly rigid conduits. This age-related arterial stiffness forces the heart to pump with significantly greater force to propel oxygenated blood throughout the body, leading to an insidious rise in systemic vascular resistance and, consequently, elevated blood pressure. Hypertension in the elderly is a ubiquitous challenge, serving as the primary catalyst for an array of debilitating cardiovascular events, including myocardial infarction, cerebrovascular accidents, and heart failure. Concurrently, the psychological landscape of aging, often marked by transitions, loss, and the anxieties of health management, exacerbates this physical decline by chronically activating the body's stress response. This chronic stress places the autonomic nervous system into a state of relentless sympathetic dominance, flooding the bloodstream with catecholamines like adrenaline and noradrenaline, as well as the stress hormone cortisol, which further constrict blood vessels and promote systemic inflammation. However, the human body is an exquisitely engineered biological machine possessing profound self-regulatory capabilities that can be consciously harnessed. Even in our twilight years, we possess an intrinsic, highly potent, and entirely non-pharmacological mechanism to counteract this age-related arterial stiffness, mitigate stress, and effectively lower systemic blood pressure. This profound intervention lies not in a pill or a surgical procedure, but in the deliberate, rhythmic modulation of our respiratory apparatus, specifically by leveraging the biomechanical and neurophysiological relationship between the diaphragm muscle and the vagus nerve. To truly appreciate the magnitude of this intervention, we must embark upon a comprehensive exploration of the biological mechanisms, neuroanatomy, cardiovascular physiology, nutritional synergies, and psychological frameworks that underpin this life-enhancing daily diaphragmatic breathing protocol. The autonomic nervous system, the vast neurological network that governs our involuntary bodily functions, is divided into two primary branches that operate in a delicate, continuous state of dynamic tension. The sympathetic nervous system is the accelerator, responsible for the evolutionary fight or flight response, mobilizing energy, accelerating the heart rate, and constricting blood vessels to prepare the organism for imminent danger. Conversely, the parasympathetic nervous system is the body's physiological brake, governing the rest and digest state, promoting cellular repair, slowing the heart rate, and relaxing the vascular musculature. In youth, these two branches exhibit a robust flexibility, seamlessly shifting dominance as environmental demands dictate. However, the aging process, particularly when compounded by the chronic low-grade stress endemic to modern life, often results in a dangerous autonomic imbalance characterized by sympathetic hyperactivity and a perilous withdrawal of parasympathetic tone. This chronic sympathetic overdrive directly accelerates the stiffening of the arteries by maintaining constant, low-level vasoconstriction, continuously elevating systemic vascular resistance, and subjecting the delicate inner lining of the blood vessels, the endothelium, to relentless shear stress. The endothelium is not a simple barrier, it is a highly active, dynamic metabolic organ responsible for regulating vascular tone, primarily through the synthesis and release of nitric oxide. a potent endogenous vasodilator. When the endothelium is damaged by the turbulent blood flow and inflammatory cytokines associated with chronic sympathetic stress, its ability to produce nitric oxide is severely compromised, creating a vicious cycle of increasing vascular rigidity, rising blood pressure, and further endothelial dysfunction. Breaking this cycle requires a powerful, targeted intervention capable of forcibly overriding the sympathetic nervous system and restoring parasympathetic dominance. An objective that can be elegantly achieved through the targeted stimulation of the vagus nerve. The vagus nerve, also known as the 10th cranial nerve, is a miraculous anatomical structure and the primary superhighway of the parasympathetic nervous system. Its name, derived from the Latin word for wandering, is an apt description of its extensive journey. Originating in the medulla oblongata of the brainstem, the vagus nerve descends through the neck, passing through the thoracic cavity, where it innervates the heart and lungs, before piercing the diaphragm to innervate the entirety of the digestive tract and the visceral organs of the abdomen. The vagus nerve is a bidirectional conduit, comprised of roughly 80% afferent fibers, which send sensory information from the organs up to the brain, and 20% efferent fibers, which transmit motor commands from the brain down to the organs. It is this vast network of upward traveling afferent fibers that holds the key to our ability to consciously modulate our autonomic state. The brain is constantly listening to the physiological state of the viscera through the vagus nerve, assessing whether the internal environment is safe or under threat. When we experience chronic stress or operate in a state of sympathetic dominance, our breathing becomes rapid, shallow, and localized entirely in the upper chest. This apical breathing pattern signals to the brainstem that the body is in a state of distress, further reinforcing sympathetic output and ensuring that blood pressure remains elevated. However, by fundamentally altering the mechanics of how we draw air into our lungs, shifting from shallow chest breathing to profound, rhythmic diaphragmatic breathing, we can mechanically stimulate the vagal afferent fibers and trick the central nervous system into a state of profound physiological safety and relaxation. The diaphragm is a large, dome-shaped sheet of skeletal muscle that separates the thoracic cavity, containing the heart and lungs, from the abdominal cavity, containing the stomach, liver, and intestines. While it functions as the primary muscle of respiration, its role in cardiovascular and neurological health is severely underappreciated. During a proper diaphragmatic inhalation, the diaphragm actively contracts and flattens, descending deep into the abdominal cavity. This downward movement serves two critical mechanical functions. First, it creates a powerful negative pressure vacuum within the thorax, actively drawing air deep into the lower lobes of the lungs, where the capillary networks responsible for gas exchange are most dense, thereby maximizing oxygen saturation and efficiency. Second, and crucially for our purposes, the descending diaphragm acts as an internal hydraulic press, massaging the abdominal viscera and generating a rhythmic fluctuation in intra-abdominal pressure. As the diaphragm moves down and pushes against the abdominal organs, it physically stretches and stimulates the delicate mechanoreceptors and sensory endings of the vagus nerve that are densely woven throughout the gastrointestinal tract and the connective tissues of the abdomen. This mechanical stimulation triggers an immediate volley of parasympathetic signals traveling up the afferent vagal fibers to the nucleus tractus solitarius, a critical relay center located in the medulla of the brainstem. The brainstem interprets these specific mechanical signals from the descending diaphragm as undeniable evidence that the organism is in a state of profound safety. In response, the central nervous system instantly withdraws sympathetic outflow and aggressively amplifies efferent parasympathetic activity. This vagal brake is applied directly to the sinoatrial node, the natural pacemaker of the heart, resulting in a sudden, deliberate slowing of the heart rate. Furthermore, the withdrawal of sympathetic signaling causes the smooth muscle tissue lining the walls of the peripheral arteries to rapidly relax. As these arteries dilate and widen, systemic vascular resistance plummets, Because blood pressure is the mathematical product of cardiac output and systemic vascular resistance. This simultaneous reduction in both heart rate and vascular constriction results in an immediate, observable, and highly beneficial drop in blood pressure. To maximize the efficacy of this physiological cascade and aggressively combat age-related arterial stiffness, the breathing protocol must be executed with a specific cadence and frequency. A concept known in cardiovascular physiology as resonance frequency breathing. Extensive clinical research has demonstrated that the human cardiovascular system possesses an intrinsic rhythmic oscillation, frequently referred to as Mayer waves, which typically occur at a frequency of approximately 0.1 Hz, or one cycle every 10 seconds. When an individual consciously slows their breathing rate to match this exact frequency, specifically taking about 5.5 to 6 full breaths per minute, a profound physiological phenomenon occurs. The respiratory rhythm and the cardiovascular rhythm perfectly synchronize, creating a state of maximum physiological resonance. At this resonance frequency, the rhythmic expansion and contraction of the lungs, the descent and ascent of the diaphragm, and the cyclical fluctuations in heart rate and blood pressure all align in perfect harmonic phase. This synchronization drastically amplifies the sensitivity and responsiveness of the baroreceptors, the specialized pressure-sensing neurons located in the walls of the aortic arch and the carotid sinuses. These baroreceptors are constantly monitoring the pressure of the blood flowing from the heart to the brain and the rest of the body. When blood pressure rises, the arterial walls stretch, activating the baroreceptors, which instantly fire signals to the brainstem to increase vagal tone and lower the pressure, a continuous feedback loop known as the baroreflex. As we age and our arteries stiffen, these baroreceptors become blunted and less sensitive, severely impairing the body's ability to regulate blood pressure autonomously. However, by practicing daily, low-frequency diaphragmatic breathing at the resonance rate of 6 breaths per minute, we subject these baroreceptors to maximum rhythmic stretching and contracting. This acts as a highly targeted form of physical therapy for the autonomic nervous system, effectively retraining and restoring baroreflex sensitivity, allowing the body to naturally and effortlessly maintain lower blood pressure throughout the entire day. Not just during the breathing exercise itself. The mechanical execution of this daily protocol is elegantly simple, yet deeply profound when practiced with intention and consistency. For the older adult, establishing a dedicated, quiet environment free from digital distractions is paramount. The practice can be performed seated in a comfortable chair with the spine erect, or lying supine on a supportive surface, which often makes it easier to isolate the movement of the diaphragm. The foundational rule of this protocol is that the inhalation must be drawn exclusively through the nasal passages. Nasal breathing is not merely a preference, it is a biological imperative for optimal cardiovascular health. The paranasal sinuses are rich in enzymes that produce a continuous supply of nitric oxide gas. When air is drawn slowly through the nose, it sweeps this concentrated nitric oxide from the sinus cavities deep into the lower lobes of the lungs. From there, the nitric oxide instantly diffuses across the alveolar membrane into the pulmonary bloodstream. As previously established, nitric oxide is the body's most potent endogenous vasodilator. It travels directly to the smooth muscle cells of the arterial walls, activating an enzyme called guanylyl cyclase, which increases the production of cyclic guanosine monophosphate, leading to profound relaxation of the vascular tissue and a dramatic reduction in systemic blood pressure. Breathing through the mouth completely bypasses this vital biochemical process, depriving the cardiovascular system of this crucial vasodilation cascade. Therefore, the protocol begins with a slow, controlled nasal inhalation lasting approximately 4 to 5 seconds. During this inhalation, the focus must be entirely directed toward expanding the abdomen outward. The chest and shoulders should remain completely still and relaxed. As the air fills the lower lungs, the diaphragm flattens, pushing the abdominal contents outward, creating a visible distension of the belly. This is the mechanical trigger for the vagus nerve. Following the completion of the inhalation, without pausing or holding the breath, the practitioner immediately transitions into the exhalation. The exhalation can be performed either through the nose or gently through pursed lips, as if blowing through a highly resistive straw. The exhalation must be prolonged and controlled, lasting slightly longer than the inhalation, typically 5 to 6 seconds. During this phase, the abdominal muscles gently contract, actively pushing the diaphragm back up into the thoracic cavity, expelling the carbon dioxide-rich air from the depths of the lungs. The elongated exhalation is critical because the parasympathetic nervous system is highly activated during the out-breath. By consciously extending the exhalation phase, we maximize the duration of vagal stimulation, deeply entraining the neurological circuits of relaxation and blood pressure reduction. This continuous, circular rhythm, a 4 to 5 second deep abdominal nasal inhalation followed by a 5 to 6 second controlled exhalation, completes one full respiratory cycle of approximately 10 seconds, equating to the resonance frequency of 6 breaths per minute. Engaging in this precise mechanical protocol for just 10 to 15 minutes twice daily, perhaps once in the early morning to set the autonomic tone for the day, and once in the evening to clear accumulated stress hormones prior to sleep, can fundamentally remodel the cardiovascular and nervous systems of an older adult over a period of several weeks. The benefits of this low-frequency diaphragmatic breathing protocol extend far beyond the immediate mechanical regulation of blood vessels. It profoundly alters the psychological and neurobiological landscape of the aging brain. The elderly frequently face unique emotional and cognitive stressor, ranging from the management of chronic health conditions to the grief of losing peers, which can precipitate states of chronic anxiety and low-level depression. These psychological states are inexorably linked to the overactivation of the amygdala, the primitive, almond-shaped cluster of nuclei deep within the temporal lobe of the brain that governs the perception of fear and emotional reactivity. When the amygdala perceives a psychological threat, whether real or imagined, it bypasses conscious thought and instantly triggers the hypothalamus to initiate the sympathetic stress response, flooding the aging cardiovascular system with blood pressure spiking hormones. However, neuroimaging studies have conclusively demonstrated that there is a dense web of direct neural projections from the vagus nerve and the brainstem up into the higher cortical centers, including the prefrontal cortex and the amygdala. When the massive surge of parasympathetic activity is generated by deep, rhythmic diaphragmatic breathing, these inhibitory signals travel upward, physically dampening the electrical activity of the amygdala. The vagus nerve essentially whispers a message of profound safety directly into the fear center of the brain. As the amygdala quiets, the prefrontal cortex, the area responsible for executive function, emotional regulation, and rational thought, comes back online. For the older adult, this neurological shift manifests as a sudden, profound sense of mental clarity, emotional resilience, and psychological calm. By utilizing the breath as a biomechanical lever, the practitioner is able to short-circuit the stress loop, preventing psychological anxieties from translating into physical cardiovascular damage. Over time, this daily practice induces neuroplastic changes, fundamentally altering the baseline resting state of the nervous system, making it far less reactive to daily stressor and vastly improving the overall quality of life, emotional stability, and psychological well-being. To truly optimize the efficacy of this diaphragmatic breathing protocol and build an impenetrable fortress of cardiovascular resilience against age-related arterial stiffness, this biomechanical intervention must be seamlessly integrated with a sophisticated approach to synergistic nutrition. The structural integrity of the aging blood vessels and the highly complex electrical conductivity of the autonomic nervous system are entirely dependent upon the availability of specific micronutrients. The most critical nutritional ally in the fight against hypertension is potassium, a vital electrolyte that acts in direct opposition to sodium within the cellular environment. While modern, highly processed diets are drowning in sodium, which draws water into the bloodstream and violently spikes blood pressure, Potassium serves to relax the walls of the blood vessels and actively assists the kidneys in excreting excess sodium through the urine. For an older adult practicing this breathing protocol, ensuring an abundant intake of potassium-rich foods, such as dark leafy greens, avocados, sweet potatoes, and wild-caught salmon, primes the vascular smooth muscle, making it infinitely more responsive to the vasodilation signals generated by the vagus nerve and nitric oxide. Equally indispensable is the mineral magnesium, often referred to as the relaxation mineral, which plays a paramount role in over 300 enzymatic reactions within the body, including those governing muscle and nerve function. Magnesium acts as a natural calcium channel blocker. Calcium is the mineral responsible for muscle contraction, including the constriction of the tiny muscles lining the blood vessels. When magnesium levels are deficient, a common scenario in the elderly due to decreased dietary absorption, calcium floods the cellular spaces, keeping the arteries in a state of rigid, locked constriction, completely negating the relaxing effects of parasympathetic stimulation. By aggressively replenishing magnesium stores through the consumption of nuts, seeds, legumes, and high-quality supplementation, the practitioner ensures that the vascular tissue remains highly pliable and capable of fully dilating in response to the slow, rhythmic breathing protocol. Furthermore, the fight against arterial stiffness is largely a battle against systemic inflammation and oxidative stress, both of which actively destroy the delicate endothelial lining and promote the deposition of rigid atherosclerotic plaques. The omega-3 fatty acids, specifically eicosapentaenoic acid and docosahexaenoic acid found in cold water fatty fish, are unparalleled in their ability to extinguish systemic inflammation at the cellular level. These profound lipid molecules integrate themselves into the cell membranes of the endothelial cells, making the arterial walls significantly more fluid, flexible, and resistant to damage. They also directly lower triglyceride levels and prevent the aggregation of blood platelets, further ensuring smooth, unimpeded blood flow. When the anti-inflammatory power of abundant omega-3s is combined with the high dietary intake of diverse, vibrantly colored phytonutrients and antioxidants found in dark berries, cruciferous vegetables, and green tea, the body is provided with a massive influx of biochemical shields. These antioxidants actively scavenge and neutralize the highly reactive free radicals that damage the elastin proteins within the arterial walls. By utilizing this strategic, nutrient-dense approach to diet, the older adult fundamentally alters the structural composition of the cardiovascular system, building highly elastic, responsive, and robust arteries that amplify and sustain the incredible blood pressure-lowering effects generated by the vagal stimulation of the breathing practice. The profound physiological transformations initiated by the daily breathing protocol and fortified by synergistic nutrition must be further cultivated and protected by the integration of vital lifestyle parameters, most notably the architecture of sleep and the implementation of appropriate physical movement. The biological processes that repair the damaged endothelium, clear metabolic waste products from the brain, and reset the sensitivity of the autonomic nervous system occur predominantly during the deepest phases of non-rapid eye movement sleep. For the aging population, sleep architecture often becomes fragmented, with a significant reduction in the duration of this vital deep sleep, leaving the cardiovascular system perpetually strained and the sympathetic nervous system locked in a state of chronic, low-grade activation. The daily practice of low-frequency diaphragmatic breathing, particularly when utilized as a dedicated pre-sleep ritual, is a profoundly effective tool for restructuring this degraded sleep architecture. By mechanically overriding the sympathetic nervous system and forcefully engaging the vagal brake in the 20 minutes preceding sleep, the practitioner rapidly lowers their core body temperature, dramatically reduces circulating cortisol levels, and initiates the release of endogenous melatonin. This physiological state of deep parasympathetic dominance allows the older adult to transition much more swiftly into the restorative stages of deep sleep, ensuring that the cardiovascular system receives the necessary hours of low pressure, Low heart rate recuperation required to maintain arterial elasticity. Furthermore, the integration of regular, low to moderate intensity physical activity, such as brisk walking, swimming, or gentle cycling, acts as a dynamic complement to the static breathing protocol, while the breathing practice trains the autonomic nervous system in a state of rest. Mild aerobic movement acts as an active stressor that temporarily raises blood pressure and heart rate, forcing the blood vessels to expand and contract. This cyclical stretching of the vascular tissue through exercise stimulates the production of specialized endothelial progenitor cells in the bone marrow, which travel through the bloodstream to physically repair microscopic damage within the arterial walls. When the structural repair stimulated by gentle daily exercise is combined with the autonomic recalibration, the restoration of baroreflex sensitivity, and the potent biochemical vasodilation achieved through the resonance frequency diaphragmatic breathing protocol, the aging individual is equipped with an incredibly comprehensive, profoundly effective, and entirely natural framework to reverse arterial stiffness, permanently lower blood pressure, and dramatically increase their total cardiovascular resilience. The human body, regardless of chronological age, retains an astonishing capacity for regeneration and healing when provided with the correct biological signals. And by mastering the simple, rhythmic descent of the diaphragm, we unlock one of the most powerful, life-sustaining mechanisms inherent within our physiology, reclaiming our health, vitality, and peace of mind with every single, intentional breath.